morning, Meridian, and welcome to Business Buzz. Today, we are joined by Liberty Tree Family Medicine, and we're joined by Dr. Ben Wilson. Welcome, Ben.
Hi, thanks.
So, Ben, let's first start off by telling our viewers maybe a little bit about what Liberty Tree Family Medicine does and the services that you guys provide there.
Sure. So Liberty Tree Family Medicine is a new direct primary care clinic in town. So it's a little bit of a different model from typical medical clinics. We do offer similar services to like your family doctor. You can come for screening healthcare. You can come if you get sick, all that. The difference is that the direct primary care model, it's actually a membership model. So it's just the doctors, just the patients. And once you become a member, then you have full access to me and to medical care in a way that just doesn't happen in the traditional system. So, for example, you can text me. You can text me pictures and I can just text you back and we can take care of you that way. So we can do telemedicine. My appointments with you are more like an hour long for a typical visit instead of the 15 minutes that you get in the system. So it's a primary care clinic like you'd get in traditional medicine, but a whole new level of experience of care. So in the direct primary care model.
So with this direct primary care that you provide, how is this a little bit different than the typical regular medical care that you would get from your typical hospital?
Good question. So the care is similar. It's that the model is different. What we do in the regular system, you kind of work through your insurance company and through usually big health systems. And they dictate a lot of how the care happens in the traditional system, meaning like they tell the doctors how long you have with your patients. They tell your patients what you can and can't have for your medications and tests and things like that. So rather than go through all the system and kind of the clunkiness of it, most of us aren't super happy with it right now with the expense and the quality we're getting there. In the direct primary care offices, we pull out of the system. So we take people that have insurance. Most of our patients actually do have insurance for emergency situations. But we don't bill insurance in direct primary care. So when you become a member, you pay a monthly fee, and that covers everything. You get unlimited visits. There's usually an additional fee if you have to get a procedure done that just covers the cost of supplies. But so it gives us the flexibility to really focus on patients and give the time we need to take good care of patients, which is hard to do in the traditional system. And then it gives us a lot of flexibility to add extra things to care that are helpful, but that are hard to get incorporated into the system. So things like point of care ultrasound, we can nowadays with ultrasound, people think of like your babies, right? When you're having a baby, you get an ultrasound. But nowadays we can use the same ultrasound technology to diagnose heart failure or fractures or blood clots. So I can use ultrasound in my office because I'm not part of that system, and it's just it's an agreement between me and the patients. I can take care of them the best way that they need rather than having to jump through all the hoops of having a middleman kind of decide what we can and can't do. So it's a lot of freedom for both me and for the patients. People love it. It's a very quickly growing model all over the country because it's so much better.
Yeah, and it sounds like a lot more personal experience with your doctor rather than the typical.
Yeah, definitely. For example, like in a typical clinic, I would have 2,000 patients or so on my panel. In a direct primary care clinic, a typical panel is more like 500 patients. So I really know the patients, they know me, and they know that when they're texting me late at night because they're worried, I know who they are. It's not just a random person in my chart. So it's definitely more personal and better care.
Yeah. So besides that you guys offer all these amazing things, what makes Liberty Tree Family Medicine unique even among direct care?
Yeah, good question. The direct primary care, and direct care is actually a good term because there are also specialists doing this around the country. It's mostly in primary care, though. Direct primary cares tend to have their own personality, their own flavor. So you have some that do more of the aesthetic stuff, and you have others that will do like osteopathic care in addition to the traditional medicine. So Liberty Tree Family Medicine, we are offering very solid traditional evidence-based medicine, but I think there's a couple things that stand out in kind of our culture, what we like to do. One of them is using technology to enhance care. So I mentioned the point of care ultrasound. We can get a lot more answers on the spot because I can use my ultrasound and just take a look at what we're worried about. And that, I think, enhances care, and that's unique to Liberty Tree Family Medicine. And in addition to that, with technology, I've taught medical students for a long time, and I've taught telemedicine. So I'm very comfortable diagnosing things virtually, especially if my patients get a blood pressure cuff and an oxygen monitor. I can do all kinds of stuff. So it gives me the flexibility to take care of people who are busy in their offices and have a hard time coming in. I could see most things and make a lot of diagnoses without them having to come in. So that technology piece is pretty unique to Liberty Tree Family Medicine. And then another piece of this is I have a deep respect for autonomy. It's kind of a contentious world right now, and people are having a hard time with different people's opinions, and that has seeped into medicine where there's a lot of anger. So I have a deep commitment to respecting patients' autonomy in my practice, and that goes in all directions. We can discuss what the best evidence is currently for a medical intervention or a test or anything, but if my patient says, I prefer not to do that, to me, I respect that. So you will not be pushed at Liberty Tree Family Medicine, whether to get a test that you don't want to get or take a medication that you don't want to take, whether it's from religious beliefs or other reasons. I try to have a good relationship with my patients where they feel respected and not pushed.
Yeah, I think that's amazing. So you've talked a little bit about your monthly membership that you guys offer. So do you kind of want to explain more? I mean, I have seen it on your website, but there's different levels. So maybe go into what you would get if you got a monthly membership and those sort of aspects with it.
Sure. Yeah, so a monthly membership costs similar to like a cell phone data plan. Most direct primary cares are a little less than $100 a month. So depending on your age, if you're 26 or younger in my clinic, then the current price is $59 a month. If you're kind of in the mid-range of an adult up to 65, then it's $89 a month, and then it goes up to $109 if you're older than that. And so you pay that monthly fee, and that gets you unlimited physician visits. There's no co-pays. There's none of that. So you can see me anytime you want. You can email me. You can text me. You can call me. It's direct access, so that you can actually communicate with your doctor when you need to. And in fact, this direct primary care model, there's good evidence of decreased utilization of the emergency department. So people go to the emergency department less often when they're in a practice like this because you can actually contact your doctor. So that access is what you get. You get a lot of the standard testing is included with your membership. Like if you think you have a urinary tract infection, you can come and get tested that. And then you can get a lot of procedures done. You can get your point of care ultrasound done. If you're worried about your heart, if you're worried about your lungs, we can do ultrasound with that. And then we can do a lot of other things, and sometimes there's an additional cost to cover the cost of supplies if we're doing a joint injection or some other procedure like that. So all that is covered. In addition, we have wholesale costs for medication. So we also dispense medication. So once you become a member, rather than going through your insurance and having the super inflated costs of your meds, we can give it at a much cheaper cost and deliver it to you right in the clinic. So that's the monthly fee, covers the whole membership, all access to us, plus some of the perks of cheaper pricing with labs and meds and all those things. So.
Yeah, well, I'm even just thinking about my insurance, and I'm like paying $20 for copay, so I'm sure it definitely evens out.
And on that note, actually, I think a big piece that people don't think about is, one, how much you're paying for your health insurance. If you look at the full year, it's a lot. And then in addition to your premiums, most people are paying a bunch in their deductible. So because we don't have co-pays, we don't have a deductible, even if you just used a little bit of that money to cover a membership, you end up saving a ton by not having to use your deductible. So yeah. It's even though it's an extra cost, it ends up saving quite a bit for most people.
Yeah. So do you want to talk a little bit about, so you have primary care and that it's this affordable aspect. So how can this be a better option for employers to provide for their employees?
Great question. So it's actually a big group of our patients that we see are from employers as part of an employer health plan. There's a lot of small businesses that want to provide some type of benefits to their employees, health benefits. And to get traditional health benefits, it is a huge cost. You can't even become eligible until you have a certain number of employees, and then they charge you so much, like $500 or more per employee per month. And so it just becomes this thing that they can't, it's not feasible for most small businesses. So a lot of small businesses are starting to turn to direct primary care, where it's not full insurance, but at the same time, you get all the benefits of a direct primary care membership. You get to see your doctor. You get to have these extended visits that are not rushed. You get the cheaper pricing. So especially smaller businesses are jumping on to direct primary care as a really good health benefit that's like much, much cheaper. So it becomes a feasible thing for the employers, and the employees love it, and they're much healthier. So it's kind of a good situation for everybody.
Yeah. Well, Ben, I want to make sure that everyone that wants to get in contact with you and learn more about your business and all of that can. So how can somebody find more information about your business or get in contact with you?
Probably the best way to get more information is our website, and there's a lot of contact information on that. So libertytreemed.com. You can learn a lot more about who we are, what we do, some of the details of what's included in a membership, and we're working on getting some more details on wide open pricing. That's one of the things we didn't really talk about is what you're going to pay before you pay it. And that you never get that in the system. You get bills a month later, and it costs 10 times as much as you ever thought it could. So we'll get the pricing up on the website so you know exactly what additional costs there are when there are. So going there, you can also call the phone number that's on our website, and you can email info@libertytreemed.com. Those are all great ways to get a hold of us, and we'd be happy to answer your questions. And we are accepting patients. There's not a 6-month wait. Like, we could see you immediately. So we're ready to take care of you.
Well, Ben, thank you so much for joining us today and giving our viewers a little insight about what it is you do and the great services that you provide.
You're welcome. It's good to talk to you, Kirsten.
Well, thank you guys for all tuning in today. Please join us next week for our next Business Buzz with Glass Doctor Kevin Kuhn. But until then, stay safe and have a great weekend, Meridian.